Okay, so today we're doing IV administration. So I've come into my patient's room, I've checked the patient's name band, make sure I have the right patient with name and date of birth. I'm going to explain this procedure to the patient, ask them if they've had any previous experience with IVs, make sure that there's no reason I can't do an IV in this arm. I have an order from my doctor. I'm going to first thing wash my hands really good. I'm going to then put on my safety equipment, make sure I have on my goggles and my gloves here. So then I'm also going to provide for privacy. I'm going to make sure that the bed is raised where I'm not bending over, hurting my back to start this IV, and then make sure that I have good lighting. And then I'm going to, like I said, I have all my stuff here, so I'm going to get it all assembled. The first thing I'm going to do, I'm going to make sure I have this flush, I want it primed. I'm not going to let anything, let's see, here we go. It's primed so we don't get any air into our patient. I'm not going to let anything touch that doesn't have a cap. As you know, I kept the cap on. I'm going to have it loosely capped so when I can just grab it when I'm done starting the IV. So I'm just going to set this over here. Okay, so the first thing I'm going to do is I'm going to put my tourniquet on the patient. I want 4 to 6 inches above my insertion site, so just make sure and we want to start distally. Everyone loves those AC veins. I'm going to find a good vein here, and then I'm going to feel for a radial pulse. The patient has a great pulse, so that's great. I'm going to remove my tourniquet, something on my goggles. At this point in time, I'm going to take my chlorhexidine, I'm going to break it, and I'm going to clean the site of insertion. Okay, and once that's there, I'm going to reapply my tourniquet. I already have my tape all cut perfect, so when I'm ready for it, I might actually move one piece down here just in case, because tape and I don't get along very well. So, okay, so I'm going to let that chlorhexidine dry. I don't want to poke the patient with a wet arm. And so then I'm going to let the patient know that they're going to feel a poke. I'm going to anchor my vein with my non-dominant hand. I'm going to get my needle here and I'm going to insert it with the bevel side up at a 10 to 30 degree angle. 1, 2, 3, big poke. I'm going to wait till I see a flash in my IV, and then I'm going to insert the cathetolon. Flush with the skin. And then I'm going to tap it on my vein here, and I'm going to hold my cathetolon. And I'm going to throw that needle in the sharps container. We want to make sure we don't get blood everywhere. So I'm going to pull back, get good blood return, and then I'm going to flush my IV. Okay, and it flushes great. So I'm going to release the tourniquet. And then I'm going to apply tape. And I want to make sure that I don't occlude the area of insertion. So I'm going to just rub on chevron. Okay. Make sure that tape down really good. That's great. And then I'm going to take my tegaderm that I have, and I've already had it my initials on it, the time, and the date. So also the patient, it doesn't stick really well. I'm going to just dry the area because there's a little bit of blood. Okay, and then I'm going to apply this. I don't want to stick it over the cap there, but I want to make sure that it covers, oh, this one's weird, that it covers the area of insertion to prevent infection. Just going to let that go like that. Perfect. Okay, and then like I said, on this side I have my name, time, and you're not going to be able to see it because it's all the way down here, but it's perfect there. And then I can remove the flush, and I can, everyone's different, everyone can do it however they want. It's just a little different. I'm going to secure the hub here and the rest of my IV tubing, because IVs can get ripped out pretty easily and nobody wants to have a second one. Okay, so then there's that. I'm going to let the patient know to let me know for any signs of infection or phlebitis. If there's any warmth, tenderness, swelling at the insertion site, I want them to call me right away. I'm going to come back every 1 to 2 hours and check the IV for patency. And then I'm going to, like I said, I'm going to come back every 2 hours, and then I'm going to lower the patient's bed back down to a comfort level, make sure to have the call light, and then I'm going to go document everything that I just did. Thanks.